Hello students, we'll discuss a common condition on table operator finding. Just see what this on table finding is. Look at that, you can see probably it is the arm, this is the elbow joint. You can see it is opened up, it's a lengthy longitudinal incision. You can see skin, subcutaneous and muscle here. And yellow, deep yellow, well localized, capsulated swelling, quite large. So naturally localized, capsulated, yellow, easily removable swelling, must be it is lipoma. So the plane is deeper to the muscle. See the muscle here. So deeper to the muscle. So naturally it is on table lipoma, submuscular plane, submuscular lipoma. You know that lipoma is universal tumor. It is also called as ubiquitous tumor because it's the commonest benign tumor in the body. It can occur anywhere in the body, subcutaneous, facial, submuscular, muscular, in the bone, in the brain it won't occur, except glia it can occur. Otherwise in the brain it won't occur. Intracranial it can occur. Then intra-articular it can occur, in the bowel it can occur, submucosal lipoma can cause intussusception, intrathoracic it can occur, anywhere in the body it can occur. Universal tumor it is called as, except brain, but in glia it can occur. So that is, it can be localized, it can be diffused. Clip sign is very typical for lipoma, all of you know. Clinically exam, they will be kept as a short case in the exam. It is smooth, soft, skin is free and not fluctuant, feels like fluctuant. It feels like fluctuant, but it is not fluctuant, remember. And mobile in two directions, very well localized. It can be localized, diffuse is common in the palm and sole. And multiple lipomatosis can occur. It can be through the syndromes. Remember, lipoma can go for calcification, saponification, but lipoma will not turn into liposarcoma. That is disproved, and that is because there is no precursor cell. Lipoma will not turn into liposarcoma, unlike nerve sheath tumors can turn into nerve sheath malignant tumor, benign tumor, but not in lipoma. In liposarcoma is an individual de novo disease, not from the lipoma, remember. And other points which you have to remember in lipoma, these are the things. What is like hibernoma, remember, often may be asked, because lipoma is from the yellow fat, whereas hibernoma is arising from the brown fat. It is again benign tumor. Lipoblastoma is a benign tumor arising from the immature fat cells. Lipoma is from the mature fat cell. Lipoblastoma is from the immature immature fat cells. Remember, it is benign. It is not a malignant. MCQ they may be asked. Lipoma arborescence occurs in the synovial sheath of the joint. From the joint or joint surface, it looks like arborescence, like a leaf-like projections. They are called arborescence. And Dercum disease, all of you know that adiposa dolorosa, multiple lipomatosis in females. It's very common in females, 30:1 female to male ratio. So all these things can be asked as a MCQ question. Viva they will ask, and oxy they may keep. So it's the commonest benign tumor which you have to remember. So answer the MCQ. Nerve abscess is seen in tuberculosis A, B Hansen disease is leprosy, Mycobacterium leprae, C Streptococcus pyogenes, D gram-negative infection. So answer this one, put it in the comment box. I will discuss that one in the comment box. So please go through my clinical methods in surgery current edition, gives very detailed, good illustrations and with the videos for all examination and manual of surgery, detail about as for CBM syllabus. Everything is covered with the photos, illustrations, quotations, illustrations, everything. My surgical operation, operative procedure, tissue approximation, and DigiNerve lectures through JP covers every subject for the PGs, basic for PGs and mainly for UGs, according to CBM syllabus with instrument, X-ray, specimens and specialties. So students, I hope you understood this one very well. Thank you very much.